0383 and 572-0215. Rev-Up St. Lucia, the alpha of radio.
Doctor in the House with Dr. Leonard Suraj, brought to you with the compliments of Laplace, Alizor, Ultramart and Tapia Hospital.
At Tapia Hospital, caring and competent obstetric consultants who will see you safely from prenatal care through delivery with a team of excellent pediatric and anesthetic support. Tapia Hospital, where the patient's safety comes first.
Looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramart. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered. And that's not all. Don't miss out on our ultra specials and promotions for a chance to win hundreds of dollars in vouchers, hampers, and special prizes. Visit any one of our 4 convenient locations today or check us out on our Facebook and Instagram page. Ultramart, your one-stop shop for all your grocery and household needs. Shop smart. Shop Ultramart.
It's delicious.
Laplace Alizor is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? Laplace Alizor, of course. Laplace Alizor, Castries, Groselet, Beaufort, and Soufrière.
It's delicious.
It's now time for Doctor in the House, hosted by Dr. Leonard Suraj. Dr. Suraj, a very good evening to you.
Good evening, Andre. Good evening, listeners and followers, etc. Andre, good evening, and I wish to express my sincere condolences for your loss. While I'm at it, I would like to take the opportunity and do a 1-minute silence to honor Tony Paul, your brother, starting now. Okay, thank you very much for allowing that. Today, welcome again, and today I have a guest who I've had before, and we'll be talking about radiology, X-ray, and for us to look at the nitty-gritties of X-rays and how X-rays and radiology at large has tremendously affected and improved the quality of medical diagnosis that we can give. There was a time when X-ray was the kingpin. Everybody, I see her passing on by X-ray, and that because X-ray was the standard. Then subsequently, ultrasound came, and with all its magnificent advantages, ultrasound became a very simple test and easily performed. Then, more recently, it was a CT scan. If you didn't have a CT scan, man, you don't have a diagnosis yet. And even further, more recent times, there is an MRI, and everybody wants an MRI, otherwise they feel their diagnosis has been missed. So throughout all this, what is becoming very clear is the advancement on science has actually caused a lot of improvement in the way we diagnose things, the accuracy with which we have it. Now, the man to tell us all about this is the gentleman I have with me, Mr. Michael Saunders. He is the radiographer at Tapia Hospital, well-trained and a very nice, pleasant guy. So, Mr. Saunders, thank you for being here with me. Of course, I did call you at very last notice, but I'm happy you were able to make it.
Thank you very much, Dr. Suraj. Hello, everybody. It's a pleasure to be here. Andre, my condolences also.
Thank you, sir.
And it is a really important topic to be presenting.
Yeah, so tell me about how radiology, I have had a little go at it, but how the whole thing has developed, and now people like you are very busy. Even in the operating theater, they go in to look at, to assist in orthopedics and other areas.
Yes.
So tell me a little bit about
Right.
what
So
you do.
right. Well, we do general X-rays. X-rays are the, I have to say, the front line, the basis of our diagnostic studies, especially something like the chest X-ray, which gives you so much information.
Right.
And moving on from that, as you said, we did develop the ultrasound capability. And ultrasound, unlike X-rays, does not use radiation. We use sound waves to image various areas of the body. And we can do everything from the brain of a newborn to tendons, ligaments in the joints.
Okay. To give you an idea of how magnificent ultrasound can be, the whole idea of sound waves bouncing off tissues and coming back, that's how the bat is able to move around so fast, and yet it never hits you. They have a sonar system that allow them to bounce the wave off the wall, it come back. The speed at which the wave come back will tell them how close you are, and they calculate this thing and just move all over the place.
And yes, it's almost instantaneous.
Yeah, and
it's similar with the ultrasound. Because with ultrasound now, we have been able to incorporate the Doppler, which is also another radar system.
Yeah.
And with that, we can measure blood flow, the quantity of flow in an area, the diameter of a blood vessel, an artery or vein. We can see if there are any deficits, any areas where there seem to be clots, especially for the lower limbs, for the legs, the arms, and the neck.
Yeah, but that's a very important area. For example, in diabetics, where if they don't control the cholesterol and thing, they have a natural tendency for the arteries to narrow down. And as it narrows down, it diminishes the blood supply to the leg. And that is why many people get their legs cut off, because the blood supply is so weak that the foot and the toes are rotting away.
Yes.
And I'm sure that you have seen many narrow arteries. And
yes, we get that. And it is quite interesting that we have even seen patients who have been in accidents, car accidents and so. And with ultrasound, they're able to measure the flow going down in the legs.
Okay.
And with the advancement of CT now, CT is really, it's an X-ray tube that moves around you and creates these images. It's almost magic. But the computing power we have today, we're able to create these images in 3 dimensions, and we have been able to measure the blood flow from the waist down to the toes.
Okay.
And where the size of the vessels was so small that it was unable to be measured with the ultrasound.
Okay.
With dye now, we're able to follow the blood flow to the extremities and see where there are some problems from injuries.
So how do you apply the dye? The dye will show on the X-ray.
The dye shows on the X-ray. It is applied via an intravenous access, usually inside the elbow.
In the vein,
into the vein.
And that's what they call the contrast.
The contrast.
Okay.
This contrast is very important.
Okay.
Without this, we would have to open up and do exploratory surgery.
Yeah.
to find out what is really going on.
Mhm.
But
Okay.
this diagnostic, the CT as a diagnostic tool has
Mhm.
been enhanced
Okay.
with the use of contrast.
Mhm.
And
And is the contrast harmful to anybody?
the contrast, if your body is unable to remove it,
Like your kidney?
your kidneys,
Okay.
you can suffer
They can-
negative effects to the kidney,
All
the
right.
tissue, and then the entire organ.
So generally, if your kidney is working properly, you don't really have an issue.
No problem at all.
Okay. So the contrast basically is a liquid that is put inside the vein,
Yes.
and as the blood flows everywhere, it identify the vessels, and you can see
Yes.
the size and how if it's blocked.
And
You can see.
blockages,
Mhm.
and if there are any masses
Mhm.
that have significant blood flow, we're able to identify their location and
Okay.
how the term is vascular, but how well serviced they are by the blood circulation system.
Mhm.
And this allows us to measure size, and it gives us a map of where
Okay.
to go for surgery and so.
Okay. Well, you can imagine the importance of that when in the heart, where the blood flow to the heart itself, because the heart is pumping blood. It's a pump,
Yeah,
but that pump need to have its own nutrition,
that's it.
and so it has vessels, veins, and arteries feeding the heart. And when you get a heart attack, is when one of those has actually got into problem.
Yes. and
Had a rupture. Most time it is clogged.
that is it. Another
Mhm.
issue that goes back to the cholesterol.
Okay.
And it's really important that we are able to produce do the study. It's called the coronary angiogram.
Mhm.
And the
Mhm.
coronary angiogram is, but before CT had advanced to where it is now,
Mhm.
we were only able to do this the conventional method, where it was relatively invasive. We have to put a tube through the arm right into the heart, and
Yeah.
the same dye we
Okay.
administer that into each artery around the heart to measure them and so.
Mhm.
However, with the CT, we're able to create an image of the heart with the blood vessels filled, and we can look at them. We can diagnose if there are any issues with these vessels,
Okay.
and this can be done when you go home the same day. You
Oh.
go home as soon as you're done.
Okay. So, so you don't have to have the cut and file the catheter right through.
Right through,
Okay.
because you have to spend at least 8 hours, maybe overnight. Usually you overnight after that procedure in the hospital
Uh-huh.
for observation, and
Okay.
we get, I would say, about 95% of the maybe 98% of the information, because
Mhm.
there's only one measurement that we don't do with the CT, which is this thing is called ejection factor. The
Okay.
ejection factor is very well measured on ultrasound,
Oh, okay.
cardiac ultrasound.
So it is possible that you can do in investigating somebody, you will need both the ultrasound and the CT scan.
And the CT,
Ah,
that's it.
It's not one or
exactly.
the other.
And we are now at a position, the machine that we have a Tapion.
Mhm.
The first time I saw a CT coronary angiogram, which was in 2012,
Mhm.
in a hospital in Canada, they did one, and the tech said, "Hey, I can show you how the heart looks in 3D."
Mhm.
It took 45 minutes for that computer to render the image.
Okay. Okay.
The machine we have now, when you're done, now we go to the processing system, the reporting system,
Yeah.
and you click. It takes about 2 seconds for it to render the image from about 600 slices that it makes.
Okay. So you
It's
can take the
amazing.
heart and turn it around and
Turn it
look at all
around,
the different
you
parts
can
of it
open it,
from.
and the software has artificial intelligence,
Okay.
where it now measures all of the vessels, all of these arteries around the heart that bring nutrients and oxygen to the muscles, and it can measure them, and it would give you a report. So it's, I don't want to say it's less work, but it gives the radiologist, the cardiologist, a little bit of direction. So it's not that they would neglect looking at the other things, but now they have something highlighted. So it makes their work a little easier. They get to a diagnosis faster. It's really important.
Okay. And similarly, if you're measuring blood flow, how much blood that goes in and out of the vessels, you're also measuring, that also tells you if it is an organ or if it is something that takes a lot of blood. For example, if you have a tumor.
Yes.
So you'd expect that the pattern of the blood flow would be different.
Yes. Yes, it
because the tumors generally requires more nutrition to survive, and more nutrition means more blood supply, and more blood supply means that you can pick it up on the, and that's why many times when they do X-ray for soft tissues, CT scan, they would tell you the vascularity of it,
yes.
how much blood is taken up
in it. And that is so good, because when we look at MRI, like how I said, the CT can scan the heart. It produces these 600 images in about 1/10 of a second. 8/10 of a second.
Yeah. Okay.
The longest run might be about a second to image the heart. The machine we have is very quick, and that is what we have over MRI. Because now MRI, as good as it is, it's a slower process. So you can't hold your breath for 5 minutes. The average patient coming in there for that, you're not going to hold your breath for 5 minutes, and then something like imaging the lungs, it's quite a long run. For the MRI to image the area around the lungs, it would take about 25-30 minutes. So for the blood flow in the lungs, the CT is ideal. And then looking at other types of tissue, that's where the MRI really, really shines.
Because at some point we will compare the CT and the MRI.
Okay, right.
But what I wanted to, you also hear of mammogram.
Yes.
And ultrasound, for example, for women and the breast, which is a better test, a mammogram or an ultrasound, or you have to do both, or
no,
depending on what you're looking for.
Depends, because everything usually comes as steps, where you would come in, you might have difficulty breathing, you do a chest X-ray, and something may show up there. And then for a female patient, they might say, well, we've had quite a few male patients too who have had breast cancer. Might say, I also feel something there. And the next step is usually the ultrasound.
Okay.
They don't jump straight into
the CT scan.
The CT or the mammogram.
Okay.
You don't jump straight into that. You may do the ultrasound.
From your clinical examination, your ultrasound is the next step. Okay. And certainly it is an easier test to do in the sense that it's not so invasive. It's just. So how does that ultrasound really operate? Because I know that they apply a little gel on the part, and they run it up and down, and then they clean up the gel and everything.
Yes.
So why you need the gel in the first place?
Well, no, it's akin to a speaker. There's a little crystal that vibrates to send out the sound waves.
Okay.
However, it's vibrating so fast, which is at a high frequency, for the sound waves to pass easily or efficiently through the skin.
Okay.
You must have the best contact possible.
Okay.
And your skin may feel smooth and look smooth, but it's not. So when you have the gel, it creates that smoothing area, that nice contact area, so that the the probe, the piece that we use to image the area with the sound, is able to create perfect contact, and the sound is able to go and return, and this, similar to the bats,
Yes.
it's instantaneous. It's
Right.
almost instantaneous.
So you send a signal, it passes through the skin, it passes through the fat under the skin. If there's muscle under it, it passes under muscle. It hits whatever, and every tissue it hits have a different image when it comes about.
Yes, it's like how we're in here. When the sound hits the walls, the area of the walls with the sound damping, more is absorbed. Almost all of it is absorbed. So with the tissue, if there's any air in the tissue, it shows up because nothing bounces back. It just goes right through.
Oh,
So you're
it
able
absorbs
to
it.
see that area as it shows up darker, but you're able to see it, and then blood flow is similar to. It is
Okay.
a lot of science, a lot of physics that goes
That's
into
right.
the creation
So
of this.
when medical young scientists or young students doing CXC, and they shy away from the physics and shy away from the mathematics, and this is what they're missing out on, because these subjects are a kind of mental discipline that you're going to use it all your life.
Exactly.
Whether you become a science person, or you become a lawyer, or you become whatever you become, the basic thing they teach you at CXC, especially the sciences, are extremely important to develop your own logical thinking algorithm process.
That exactly is it.
And so that is where it becomes useful. So, and that's why you find if you have done science, you can adapt to any other specialty, whether it is the arts, whether it is history, wherever you are. It gives you that kind of ability to think logically, clearly, foolproof.
Exactly.
And that's what education is about.
Yes, because anybody who does pure math, they will tell you could solve anything with math. They
Yeah,
will tell you that.
that's right.
You can.
And the science in that is that even when, long before even ultrasound, when we were examining a patient, you go with you in the back of your, and on the back, and go tuck, 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 you percussing. They call percussion. And that is where you take your finger and you hit. If it is on the abdomen, you'd hit the abdomen. If it's a hollow sound, you know there's gas. If it's a heavy sound, you know it is tissue or inflammation or something. So even then, we were using that as our ultrasound.
That was ultrasound. Exactly. Doc.
So it is interesting to see where the science has gone.
The progression. of
And
it.
so a modern medical student may not even know how to do percussion. But when you're out without the technology, that's what you rely on.
That is
And it's
it.
very important.
Exactly. That was the basis.
Yeah. So because when you hit the skin, the sound goes and comes back. Hit whatever wall, just like an echo.
That is it.
You in the room and you say yes, and you hear yes, 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 yes. That's the echo. So the echo is what the ultrasound relies on.
That is
And
exactly.
it is of tremendous value to us.
Yes, as simple as that.
So say you're examining a breast. Somebody has a lump in the breast, and you decide after you palpate, etc., that you want to do a test. Then the next test would have been an ultrasound. And the ultrasound will now tell you, is it a solid thing? Is it a cyst? And a cyst, by definition, is a little bag of fluid.
Right.
And so it can tell you whether it is flesh, tissue, air, fluid, whatever. So,
tumor.
so you have a
Yes.
tumor, it can tell you all that.
And does the same, it would also show you if there's any blood flow.
Right.
Right, so and that's when you get into now the next step would be the mammogram,
The mammogram, okay.
which is X-ray based.
All right.
The equipment we have now, they don't just do the simple two views.
So what the mammogram show?
The mammogram is an X-ray, a specialized X-ray of the breast tissue, and it is able to separate any masses from the surrounding tissue, unlike plain X-ray,
Okay.
which, unless the mass is very dense, so it is, because what X-ray does is different densities, it shows different shadings. So if something is denser, it shows up brighter against the surrounding tissue, or a different color.
So if you have a lump, like a growth inside the breast tissue, then it will show you the skin, it will show you the fat, because the breast is almost all fat.
All fat, right.
And after the fat, it will show you that there is something else which is denser than fat.
Denser than
there.
fat. Yes.
So that's how you pick it up.
And right now we're able to do studies with contrast of the breast.
Okay.
And the newer machines, I'm talking within the last 5 years, are able to do the same 3D view. So now you have a better location of where the mass is, and how vascular, how much blood is flowing through it, and the ability to diagnose and move forward with therapy. Every day it's getting better.
Yeah.
And it is at a point where we need to let ladies know there's something you have to check regularly. This is not wait until I think I feel something. No, you have to do this regularly.
And mammograms are widely available now.
Yes.
And it is not invasive. All I remember some ladies tell me when they've done a test is that the thing squeezed their breast very hard.
It's painful.
Now you've had, they've told you that too?
Yes, you get that from a lot of people.
Because I suppose you're trying to create, to make it as compact as possible.
Yes.
So that you get more information.
Yes. Because if it's, as you're saying, if it's too loose, you don't get that information clearly from it. You then say, oh, this may be.
Right.
Then you'll have to repeat the study.
Yeah.
So that's done properly.
And after that, so say if you do the mammogram, why would you want to do an ultrasound? Is there a role for ultrasound there?
Well, ultrasound would have been the step before, so then you come forward.
And you do mammogram. That's right.
Then you do the mammogram.
And then you notice, well, there's definitely a lump there.
Well, yes. So that's where you will go back to they call it biopsy guided ultrasound.
Oh yeah, right.
Where you will do a biopsy of this mass because you've done your due diligence and it's of concern, and you need to know what this tissue is.
Yes, right.
So then you would use a specialized syringe with a needle to remove, it's under sterile conditions, to remove a piece of the mass. Just a little bit to check in the lab.
What it is, yeah.
To see what type of tissue.
The challenge here is that you have, whether it is the breast or whether it is the foot or anything, when you see the image, where you think it is, it may not be there, because if you have to have it in a three-dimensional thing. One dimension, I'll just explain.
Yes.
One dimension is length. The length is one. 2 dimension is length and breadth, which is area. 3 dimension is volume. Length, breadth, height. So in this little box of 3 dimension, if there is a tumor in the middle of that space in the box, wherever you look at, if you take one needle and go for it, you may miss it because you may have 2 of the coordinates, but you're missing a 3rd one. And so it can be very difficult, and that's why you need ultrasound guided. So the ultrasound will see where the lump is, and the operator, who is the radiologist usually, will put a needle looking at the ultrasound to ensure that needle hit exactly the lump that you want.
Yes, and it is...
Dr. Suraj, sorry, we'll take a break. We'll come back in just a moment.
All right. I was just getting warmed up.
This is live Dr. Leonard Suraj on Doctor in the House, brought to you the compliments of La Place Saint-Lazare, Ultramart, and Tapia Hospital.
Tapia Hospital Radiology Department offers 24-hour service. We provide you with X-ray, CT scans, and ultrasound imaging using the most modern equipment that produces the best images for your medical attention. Call the radiology unit at 459-2201. Tapia Hospital, where the patient's safety comes first.
Looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramart. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered. And that's not all. Don't miss out on our ultra specials and promotions for a chance to win hundreds of dollars in vouchers, hampers, and special prizes. Visit any one of our 4 convenient locations today or check us out on our Facebook and Instagram page. Ultramart, your one-stop shop for all your grocery and household needs. Shop smart. Shop Ultramart.
It's delicious.
La Place Saint-Lazare is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Place Saint-Lazare, of course. La Place Saint-Lazare, Castries, Groselet, Beaufort, and Soufrière.
It's delicious.
Welcome back to Doctor in the House with Dr. Leonard Suraj. Dr. Suraj, welcome back.
Thank you again, Andre, and thank you, listeners, for remaining tuned to the program. I'll tell you that if you have any question to ask, Andre can give you the numbers. I don't have it exactly with me.
No problem. The fixed line is 572-9710. Fixed line 572-9710. Or you can WhatsApp 287-0971. WhatsApp is 287-0971. And Dr. Suraj, it may be a good point to reintroduce your guest and your topic for tonight.
Yeah, so the topic for tonight, thank you, Andre, for keeping me in check. The topic for tonight is radiology, X-ray, and how X-ray and radiology, that service, how it has revolutionized our practice of medicine and our diagnosis of patients' problems. It has gone a long way and continue to improve in leaps and bounds. So I have with me Mr. Michael Saunders, who is our radiographer at Tapio, and he is here with me. We're discussing different types of radiological service you can get from the radiology department. There's a term.
You have a caller? You have a caller?
X-ray department.
Yes.
Yeah, I think we have a caller.
Yes, you do.
Headphones.
Yeah, good evening. Thank you for calling.
Good evening.
Good evening, sir.
Andre.
Good evening. Welcome.
Good evening, Doc.
Let me hear a bright question from you now.
And good evening, the other Doc. I can't remember his name.
Michael.
Michael.
Yes, thanks.
Michael. Oh, the Archangel.
Radiographer.
Okay, thanks for accepting my call.
Okay, you're most welcome.
Doc, I don't know much about those machines you're talking about there. But as a physician, when you're doing those tests on people, if a standing position and a lying position, in which one you get the better result?
Let him tell you, but I think it depends on what you're looking for.
Exactly, Doc. No.
Yeah,
If you come for...
because if you go in...
Go ahead. If you go in...
For example, if you check in the breast, if the person lie down or the person standing, will you get two different results there?
Let's say you.
When you're lying down, now the breast tissue would fall back into the body, so it will be difficult to get the entire breast compressed.
The thickness from top to bottom or side to side. you need to capture as much of the thickness of the breast.
Yes.
If the person is sitting or lying down, then it just spreads all around.
Muscle moves into relaxed.
So in a position, so standing up is the best one, a better one.
Yes, exactly. Because the breast tissue it hangs off of the body, so you're able to grasp more of it to get the two views, the top, pressing it from top to bottom and then from the sides. That is the best.
Also, there is a difference between the standing up examination and the lying down examination.
Right.
Because most examination I've been through, they have been put me to lie down.
That is for X-rays.
For mostly everything.
Well, there's a lying down. You lie down for certain reasons, and you stand up for certain reasons.
That's it. No, there are X-rays. Let's say, for example, of the abdomen. When you
abdomen, for abdomen,
the
how
belly.
you do?
Belly.
The belly, yeah. What? With the best ways?
No.
Lie down or standing?
When you do it lying down, we would be looking for something like the kidneys to see if there are any kidney stones, any. Well, you don't just in the kidneys, but the kidneys right down to the bladder. And in that position, we can see air in the large intestine and the colon. However, when you are standing and you do that same X-ray, we can see if there's any what we call free air, if there's air outside of the colon of the large intestine, and if any of it in the large intestine is causing it to twist. You can actually see that, and you can see if there are any they call it fluid levels, where there's liquid in the intestine and then the air, and this is painful, eh? Having this situation can be a little quite uncomfortable.
So both are important. So that means when I go, I have to take both the lying down and the standing up.
Depends on what you're looking for, what complaint you come with.
Right.
Because if I lie down, doc, there are certain things you might not see, and if I standing up, there are certain things you might not see. So that means I have to take both the lie down and the stand up.
There is a series.
Okay, I'll make somebody.
Abdomen series.
Thank you.
Yes. Yes, go ahead.
He hung up.
Oh. Yeah, so basically, again, it is what you're looking for, whether it is best demonstrated by lying down or best demonstrated by sitting up.
Because the chest X-ray, we do maybe 90% of them with a person standing in an erect position. Right. But if you come in with trauma from a car accident and you're on the board, on the spine board, we have to do it with you in that position.
That's right.
Because we can't shift the patient. And then at that time, we're really looking for something like maybe a collapsed lung or injury to the ribs. So
and a collapsed lung is when one of the lungs shut down completely. Air gets in between the lung and the rib cage.
Yes.
And the lung just flattens, it's not working.
And you're there struggling to breathe.
Well, you're breathing on one lung. So you see that best if you're standing up.
If you're standing up.
Yeah.
Or, for example, like I said, a patient coming from some type of trauma, you don't want to move them too much.
Yeah.
In a lot of centers now, the protocol is to do a plain CT scan of the chest and abdomen.
Okay.
To verify what's going on. And on the CT, you will be able to distinguish if the patient has a collapsed lung, if they have any liquid in the lung, blood or so, and any other injury to the tissue,
like your liver,
the organs,
liver bleeding from inside.
And it is an essential tool, especially for trauma. The
CT scan.
Yes.
Okay.
Yes.
And CT if you compare CT and MRI, the CT scan has some radiation with it,
Yes.
so it has to be considered,
Always consider.
especially when you're going to use CT often.
Often
And on the other hand, MRI is magnetic based.
magnetic based.
So if you are going to do an MRI, I'm sure there are precautions you would ask the patient.
Yes. One of the major things we ask them is if they've been around any metal work. If
Oh.
they've done anything with metal work.
Really?
Because-
So if you were grinding some metal.
Yes.
Okay.
The little pieces could get into your fingers. Okay, that's fine. But if you have any shards, any fragments of metal that get into the eyes, especially the eyes,
Mhm.
the magnetic field is so strong. In some instances, it could move these little pieces of metal within the eye, and a sharp piece of metal moving through that soft tissue, it can injure little blood vessels, arteries, little veins, nerves. But not just that. Because of how a magnetic field works, it can create this transfer of energy where the metal moves and starts to generate heat.
Okay.
And this heat can also cause damage, and damage in the eyeball is a serious thing.
Yeah.
And what is done, we would have the patient do a x-ray of the head,
Okay.
because the
To make sure
metal
there's no metal.
shows up like little white spots,
Okay.
and that can disqualify a patient from doing an MRI,
Okay.
because we can't shield just the head from the
Mhm.
magnetic field. It's not possible.
So it's almost the whole body that goes in the.
And even if you're just doing the head,
Mhm.
the rest of the body is exposed, because as you get into the area of the MRI, the field is so powerful. You have to be checked before you come in. No metal, nothing, no watch, no pens. Even pens become missiles.
And things like pacemakers.
We have gone to the point where there are MRI safe pacemakers. They cost a little more,
Okay.
but
Okay.
you are still eligible to do an MRI.
Safe.
Well,
But
having
if you
it.
have a pacemaker, you must tell the people that you have it,
Yes,
so that they will not. They'll take the precaution necessary.
because if as you said, there have been instances where people have been injured, where somebody comes into the room with, or gets close to the room, and as the door opens, an oxygen tank, because it has some iron in it, some steel, and it just goes flying. Yes, you might be wearing a watch and you feel your hand raising up, because it is so powerful.
Okay, that's a magnetic field.
Magnetic field. It is really, but it's amazing how it produces the images.
Yeah.
It produces the images by realigning the hydrogen in the water molecule in your body,
That's right.
and then a
Because-
radio
because
wave
we are like
reads it.
70 to 80% water.
And water is everywhere in us.
Yeah.
And with that, we're able to create these images with radio waves, with the hydrogen in the water aligned, and it could change the alignment.
Okay.
That is a lot of physics again. It's called weighting, so it can give you the tissue looking black, and when it changes the
Orientation.
weighting, it gives you it in
A
white.
different color.
Yeah,
Okay.
white or shades of grey. It's really, really impressive how it can work.
And you can have MRI often. It doesn't.
Oh
really-
yes. Oh yes.
It does not give you any radiation effect.
No
etc.
radiation, and unlike the electromagnetic effect, electromagnetic waves can cause brain injuries, but that's when it's created by a coil, not by how the magnetic field is created in the MRI.
In the
machine.
MRI,
so
okay.
it's safe.
Okay.
The only thing is, it takes quite a while to create the images. So for like how we were describing a patient suffering trauma coming into the department, you wouldn't be able to do an MRI of the chest and abdomen quickly to see what's happening, because they would have to be there for more than an hour to create this set of images. So it's not done for emergency purposes like that.
Okay, so it takes a little longer for the machine to warm up, so to speak,
basically,
and to give you the exact reading. But what would be the main areas of strength of an MRI? I know it is good for soft tissue.
Yes.
Not so good for bone. I think CT scans are better for bone.
CT scans are better. The bone, well, when you look in the bone and how they interact with ligaments and so, that is the forte. They're really able to give you nice, clean separation with those types of tissue.
That's an MRI?
Yes.
Okay.
Yes.
All right. Where the tendon latches onto the bone.
Yes.
Okay.
They could show you a minute tear.
Oh, okay.
Yes.
And joints too, I would imagine the MRI would be good at doing the joints.
Especially for athletes, they get the repetitive motion injuries, elbows, shoulders, wrists, even the wrist. It's very good at imaging those areas, the knees, ankles,
and the meniscus inside of it, and the cruciate ligaments.
It shows them in high detail.
And those are kind of areas where athletics get damaged.
Yes.
Because I remember reading a particular article and a presentation some time ago when they were saying that the football player keep on having pain in the knee and couldn't find anything until they did the MRI and found that the meniscus was torn partway and could not have picked it up.
Yes.
So each of these modalities have their strengths, of course.
Definitely.
And but I know that when it comes to having metal objects, for example, in the same way when you go through security and passing through the screen, if you have a metal in your leg, say a metal in your femur or somewhere, it will show. Similarly, if you have any of these metal prostheses, that's an area you have to be careful.
Yes. I know they have been using thermoplastics, these very cutting edge types of plastics that they have now, and titanium and platinum.
Titanium.
Well, they cost a little more, but you remove the danger.
Okay, so they are overcoming that issue.
Yes, yes. Because
titanium is strong.
It's very strong, and we use it all the time. I know that it is used quite a lot here.
Do you have a particular questionnaire? For example, if somebody is going to have a CT scan, is there a set of questionnaire you'd ask them to ensure that there are certain things that you want to know? I know for MRI you'd ask a few questions about metals, about whether they have any prosthesis, whether they have any heart valves, or whether they have pacemakers. Very important.
Yes, you have to run this checklist.
Oh, you have a checklist?
Yes.
Okay.
And we even if they just come in to do a plain CT, we still ask them a CT without the contrast, the dye. We still ask them some questions about even claustrophobia. If they have any metal, whether it's ornamental or something that maybe have been there from surgery. Because even things like you made them have done thoracic chest, open chest surgery, and then it's closed up
clips
with
and things in the hand.
And we have a questionnaire that you must fill out for the dye, which asks you things like medication you're on and allergies.
Okay.
Because, well, the good thing is if you have food allergies, we are able to give you prophylactic something to prevent you having a reaction.
Very recently, actually, I had a patient who was going for a CT scan, and she said that she's allergic to shellfish, and so she had a dose of medication before.
That's it. Shellfish is high in iodine, and the dye we use, the contrast, is iodine based.
Okay.
Because the iodine shows up white under the CT. So it's able to show us, well, wherever the blood vessels run, the arteries and veins, we can follow them as it's going through.
Okay.
So it is.
Yeah, so the MRI has been a tremendous advancement.
Yes.
And back to the CT scan. The power of your CT scan is based on how thin a slice you can get.
Yes.
Because I remember somebody was making the example that to understand the power of the CT scan, it's almost like you have a pan loaf, sliced pan loaf, okay? And if there is, say, like a red bean in one of the slices, if your slice is big enough and bigger than the red bean, you may never know there is a red bean in there. But if your slices are small, somewhere you'll cut part of that.
That's it.
So what it is saying essentially is that the thinner your slice is, the more accurate they are.
Yes. The first CT machine, which would have been what they would have called a one slice.
Okay.
No.
So it just gives you a cross section. And remember, the CT generally is a cross section.
A cross section, and that would have been, I think it's about 10 centimeters, and
almost 2 inches.
Yes, we got down to a 16 slice, which is 5.
10 centimeters, almost 4 inches.
Almost 4 inches. Yes.
Yeah.
And the 16 slice, which was the big thing 20 years ago. That was
16 slice.
That was 5 millimeters thick.
That's
and
right.
You could still miss something.
Yeah.
So the machine we have installed is 8 times. The slices are 8 times smaller. So the slices are 0.6 of a millimeter.
Of a millimeter.
So we can't even cut a human being cutting with a knife. We can't even cut the bread that thin.
Yeah. So it's so thin. So that's why. So at that stage, you can pick up a tumor that is 1 millimeter size.
Yes.
Yeah.
Sub millimeter. Yes.
Yeah.
Yes, just about that.
And so the power of the CT is, and it gives you a cross section at all the time.
All the time.
So it's just like a cucumber.
Yes.
You cut a cucumber and look at the cross section, and so that's what CT scan does. It slices. That's why they call it. They say 6 slice, 100 slice, 126 slice, etc.
Right. And right now, I know some research centers have there would be a 320 slice machine.
320.
That 256, and then those are just for research.
Okay.
Because they would image the heart. The reason we have a limit on how fast the heart is beating to do the study is because of how fast the machine can run. But the more slices, the faster it can image. Yes. So.
But despite all these things, a chest X-ray is always a very important thing to do. And even now, the protocol is that if you are over 40 and you're going to have an operation, being put to sleep, it's mandatory to have a chest X-ray.
Yes.
So we have not come off that. The fact that there is CT scan and MRI that have stolen the stage, X-ray and ultrasound and mammogram still have their particular usefulness. Less expensive, and I think what the general public need to know, it's not like going and buy the most expensive car thinking that it's going to give me the best ride. There are some things that MRI is strong for, there are some things it is weak for. And so you ought not to be telling your doctor, I want an MRI. You all must discuss what the problem is, what you're looking for.
Exactly.
And based on what you're looking for, your doctor and yourself will sit down and work out what is the least expensive option for you. And
Exactly.
in other words, what you're looking for is value for money. Not because it's an MRI to expect it to be a magic that can discover everything in your body. And we must try and be a little, the general population, a little more informed and understand the strengths and weaknesses, so that if your doctor thought that an ultrasound is a better thing for you, don't push for an MRI just because you think an MRI will show other things. Because all is about what your complaints are, what is the physical finding, what are your possible diagnoses, and what investigative modality we're going to apply to reach your problem. And that is the way we should be thinking.
Yes, it's not about, I want to tell my doctor what I want, so I'm going for this. The doctor knows that there are certain steps that must be taken first, and you can't go for the hammer.
Yeah, and I have it, patients come to me and say, I want an MRI. And because of the inaccurate knowledge of believing that the MRI is a magician that can just find diagnosis for you. And also, you, the doctor who is requesting the study, and I'm sure you will agree that they must communicate with their radiologist or radiographer. And on the requisition form where you say X-ray, you just don't say X-ray of the sinuses. You say what you're looking for. The person have a headache, or the person may have facial pain or whatever. You have to write the clinical history for the person who's doing the test to assist you in the diagnosis.
Yes.
And I'm sure you may have seen requests that are very poorly constructed and not giving you all the information you want.
That's right. Chest X-ray.
No, chest X-ray. CXR.
CXR. What are we looking for? Is there something specific? And then you have somebody who just says, okay, CT of the head.
Yeah, right, CT of the head.
And we got a loss. But this is where you speak with your patient and still you give the doctor a call. Say, "Doc, this was sent through." Because communication saves a lot of problems. Saves you a lot of headache down the road or having to repeat the study.
That's right.
So you get that cleared up, and we might say, "Hey doc, based on what you want, the MRI would be better."
Okay.
Because you might say, "Okay, I need to get a detailed view of the air canal. I need to know what's going on with the bones and so in there."
That's right. Yeah.
CT, fine. But you want to go on to something with tissue.
That's right.
And so
like I was telling somebody that if you're investigating a cholesteatoma, which is a kind of cheesy type of disease, it eats away the bone, get into the brain, get into the ossicles, eat away the little bones of the air, does all kind of thing. But it does it slowly.
Yes.
So your radiographer and radiologist should guide you which is the best way to approach it, whether a CT scan, an MRI, whatever, to pick up the soft tissue, the cholesteatoma and thing.
Yes.
And whether if somebody has a Bell's palsy, could it be a tumor or could it be a Bell's palsy? And then you now have to rely on your radiologist and radiographer to be able to map out the internal acoustic meatus to see where the issue is. So we should not pretend that we have the answer. The fact that you're doing a test is that you're looking for something and you want confirmation with your allies. That can give the patient better value for money.
Oh yes, it is. That's the only way. And everybody has to be on board and
and communication, as you said.
Work together.
Yeah. because many a time you find that the communication needs to be improved upon.
Yes.
So I think you are getting close to the end, and although Andre have not looked at me, but I suspect he'll look at me very shortly.
I've been listening.
You listening. So yes, listeners, thank you very much for participating and for listening. And Mr. Saunders, any last few words you'd like to tell to the general public, especially those who want tests done? Any particular advice you can give them, or any instruction, some parting words that you'd want to tell them?
It is very good to let your doctor know everything, and when you come to the department, be candid with us, because there are certain things that your doctor may have missed that we can help you to get as Dr. Suraj has said, get the best value out of the studies, and maybe even direct you or your physician along a better path. So communication is not just with the doctor and us and you, it's with you and us. So let's
Great.
get together.
Thank you very much, Mr. Saunders, Michael,
Thank you all.
and the listeners. Thank you for listening. And next Tuesday, I'll be here again. So I wish you all the best for the rest of the week.
Thank you,
very
Dr.
much.
Suraj,
Very nice.
as always, for your service, and to your
you.
special guest. Thank you. You've been listening to and viewing live on Rev-Up St. Lucia, 95.9 FM, Doctor in the House, hosted by Dr. Leonard Suraj. So listen again next week, Tuesday, same time, from 6 p.m. to 7 p.m. for another Doctor in the House, brought to you with the compliments of La Place Salazon, Ultramart, and Tapia Hospital.
At Tapia Hospital, we operate a 24-hour emergency service for all your urgent healthcare needs. Our qualified medical specialist will be on hand to ensure that you receive the best of care. Call us at 459-2617. Tapia Hospital, where the patient safety comes first.
Looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramart. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered. And that's not all. Don't miss out on our ultra specials and promotions for a chance to win hundreds of dollars in vouchers, hampers, and special prizes. Visit any one of our 4 convenient locations today, or check us out on our Facebook and Instagram page. Ultramart, your one-stop shop for all your grocery and household needs. Shop smart. Shop Ultramart.
It's delicious.
La Place Salazon is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Place Salazon, of course. La Place Salazon, Castries, Groselet, Beaufort, and Soufrière.
It's delicious.
Rev-Up St. Lucia is located at Unit 4, Gablewoods Mall, Sunny Acres, Castries, St. Lucia. Tune in to us and online at revupslu.com. Call the studio at 572-9710 or WhatsApp